Good morning, guys. I'm just getting to the office, and before my patients come in, I want to give you a video on posture. This week has been about posture, and many people, when they come into the office, want to know how to prevent their bodies from getting worse. And so I've gone over sleeping, and I've gone over sitting, but now I want to go over standing. So when we stand, a lot of people are under the impression they need an arch in their shoe, and they think they need these orthotics. But the problem is that the orthotic that you put in your shoe actually causes problems. It doesn't say it causes problems, but it shifts mechanics around. So let's say you went in to get an orthotic because you had foot problems and it fixes the foot problem, but it just shifts the mechanics to the next joint, and now you got hip problems, you got neck problems. I've had patients that have come in here, and when they come in, they might have some sort of issue regarding knee pain. And we start correcting the knee pain, but then they got some other problem, we get rid of their orthotics, and that goes away. The only reason somebody uses an orthotic in their shoe is because they don't know how to fix mechanics correctly. We can do that. I got patients that actually had no arches in their feet, and they have arches in their feet now. So the approach that I take when I actually work with patients is I correct their mechanics, but I want to fix their shoes. So if we have a big arch in our shoe, what ends up happening is it causes your feet to actually supinate. And if your feet supinate, your fibular heads turn in and your femurs turn out, and it pushes our mechanics forward. And so if we're forward, there's going to be more stress on the low back. Especially when you're working out, that's not what you're looking to do. You want to keep that mechanical stress off the low back. You want to keep upright. And we want to prevent bones from going forward. So if you're in this position all day long and push forward, you're going to be at a mechanical disadvantage and have a higher prevalence of having issues. So the approach I go is I have these little inserts in a tennis shoe, and it levels out the shoe so it's flat. Or I buy flat shoes. So when I train, I actually wear wrestling shoes, or I have shoes like Orthotics shoes, and I make sure that I doctor them up so that they're perfectly flat. Vivo Barefoot makes some flat shoes. There's a lot of choices that are out there to address the standing issue. And for women, a little bit of a heel is okay. It's probably not the best for your feet, but it's great for your spine. So that's a little bit about posture today. Take that out there and utilize that. My recommendation is do not use orthotics. Make sure that you change your shoe and get your mechanics corrected. Because we can do that. The arch in your foot can come back if you see someone that knows how to change mechanics correctly. All right, guys, check me out at www.protouchrehab.com and subscribe to my YouTube channel at Dr. Steve Spencer. I'll be talking to you soon.